high temperature of 92 degrees. Look for a clear night tonight, low 66. Tuesday, bright and sunny with a high of 92. For the Inland Empire this afternoon, sunshine, the high temperature 94. In Palm Springs, we're going to have a sunny day with a high temperature of 106 degrees. I'm meteorologist Jim Rinaldi for Smart Talk 1490 KMET.
Take KMET 1490 AM with you everywhere you go by downloading our free smartphone apps found on the KMET website, KMET1490am.com. You can also go to the Google Play Store or the Apple App Store on your phone to download the free app. Now you can listen live or play any of your favorite programmers' podcasts using your smartphone. Don't miss out on the free KMET smartphone apps. Go to KMET1490am.com and download your free phone app today.
The Inner Voice Show is a dialogue between the host and the listeners about their relationships. This show is not an attempt to assess, diagnose, or treat any mental health or illness condition. Please consult your physician, psychiatrist, or psychotherapist for personal matters.
Inner Voice. A heartfelt chat with Dr. Foojan.
Hello, everyone. Welcome to the Inner Voice Show. I'm Dr. Foojan Zeine and have Sean in studio. This is a show about what matters most in our life, our minds, our thoughts, feelings, actions, relationships, and our fulfillment in this beautiful journey of life. In this show, I'll bring you Dr. David Burns. He is the adjunct professor emeritus in the Department of Psychiatry and Behavioral Sciences at the Stanford University School of Medicine. Today, we will talk about his latest book, Feeling Great. Dr. Burns shares his latest approach in making you feel great in 2 hours. Yes, within 2 hours. I'm serious. Then I'll speak to Bridgit Dengel Gaspard. She's a licensed social worker and the author of The Final Eighth. We will talk about how having a voice dialogue with different parts of us allows us to be unified and healthy. And before that, I'll share with you a research from the University of California, Irvine, about how just being in the environment and hearing so much about the COVID-19 puts us in a lot of stress and depression. But first, let me share with you the tip of the week. Today, I'd like to talk to you about how we push ourselves toward exhaustion, a state of extreme physical and mental emotional fatigue. If you're slightly agitated, snap easily, and a bit depressed, or have heightened anxiety, have a little to zero tolerance for anything out of ordinary, feel shooting pain or stiff muscles, you feel dizzy at times, and have no time to sit down and eat even, or can't enjoy even a simple video or a TV show, you feel tired after sleeping 8 hours, or any other symptoms that you think it feels like you're exhausted, you may be overworked and under stress. I really experienced that this past week, so I wanted to share with you that. I had a client who was a physician, and at times she would come to my office and cry the whole session from exhaustion of having to pull out all-nighter shift at the hospital. I see couples who have major fights when one or both of them are exhausted. And I also have witnessed many clients who have deepened their state of anxiety or depression when they have overworked themselves. For some people, this is not a choice, but life circumstance. For example, parents of newborn babies be exhausted for not sleeping at night, or a nurse or a physician that has to work multiple shifts in the crisis, or someone who has to work 2 jobs to make ends meet to raise a family. For some others, it might be just a way of life. They need to fill up every moment of their life with activities, not noticing the toll that it puts on their psyche, body, relationships, and life in general. If it's happening over and over again, maybe a form of addictive behavior as someone continues to live a lifestyle that doesn't work for them, right? So, are you feeling exhausted? What are your reasons? Well, it's time to stop and evaluate your work and socialization and all habits. Here's some suggestions. Try to sleep 7 to 9 hours and eat appropriately. Do some activity or exercise, whether it's cardio or yoga. Maybe meditate, even if it's 10 minutes. In the afternoon or somewhere during the day, take 20-minute power naps. Only 20 minutes, but they're amazing. Reorganize your workload so that you can take care of yourself. Reorganize your socialization so that you can actually enjoy them rather than being a form of obligation for you. Redefine your purpose of life and see if what you're doing daily is aligned with your life purpose, or you're just kind of like doing things like a rat in a wheel. Begin scheduling one enjoyable hour just to be with you, and another one just to be with a loved one. So take care of yourself. There's only one of you, and it is the you, only you, who can take care of you. Don't go anywhere. We'll be right back with the latest research.
Have you ever wished you could just wake up one day, reach across your nightstand, and hit the life reset button? Let's face it, the struggles and frustrations of everyday life leave millions of women and men around the globe yearning for a new way. And the new way is right here in Life Reset, the awareness integration path to create the life you want by Dr. Foojan Zeine. You can get it now at Foojan.com or Amazon.com. Life Reset, the awareness integration path to create the life you want. You deserve it.
Hello, we're back. Let me tell you about the latest research. Experiencing multiple stressors triggered by the COVID-19 pandemic, such as unemployment and COVID-19 related media consumption, are directly linked to rising acute stress and depressive symptoms across the U.S. According to the groundbreaking University of California Irvine study, which was published in the Science Advances. The researchers state that the pandemic is not hitting all communities equally. People have lost wages, jobs, and loved ones with record speed. Individuals living with chronic mental and physical illnesses are struggling. Young people are struggling. Poor communities are struggling. Mental health services need to be tailored to those most in need right now. In addition, the research highlights the connection between mental health and exposure to media coverage of the COVID-19 pandemic, suggesting the need to step away from the television, computer, or smartphone to protect psychological well-being, because the media is the critical source of information for people when they are faced with ambiguous, ongoing disaster. But too much exposure can be overwhelming and lead to more stress, worry, and perceived risk. Using NORC, AmeriSpeak panel, the study was the first of its kind to examine early predictors of rising mental health problems across the nation. The design let researchers evaluate the effects of the pandemic as it was unfolding in real time. Over the course of the study, the size of the pandemic shifted dramatically. Accordingly, people surveyed later in the study period reported the highest of acute stress and depressive symptoms. The UCI team's findings offer insights into priorities for building community resilience in the face of COVID-19 pandemic. So first, those with pre-existing mental and physical conditions are more likely to show both acute stress and depressive symptoms. Secondary stressors
Job and wage loss and shortage of necessities are also strong predictors in the development of these symptoms. And thirdly, extensive exposure to pandemic-related news and conflicting information in the news are among the strongest predictors of pandemics specific acute stress. So the researchers concluded that it's critical that we prioritize providing resources to communities most in need of support right now, the unemployed, the poor, or chronically ill people and young people. We also encourage the public to limit exposure to media as an important public health intervention. It can prevent mental health and physical health symptoms and promote resilience. So take care of yourself in any of the categories you are. Find the resources and get your news in one way or another, but don't overexpose yourself to all of that. We'll be right back with our conversation with Dr. David Byrne.
Join the conversation every Monday afternoon at 3 p.m. Pacific for Inner Voice Heartfelt Chat with Dr. Foojan. Dr. Foojan is a radio and TV host, international speaker, psychotherapist, life coach, and the author of Life Reset, The Awareness Path to Create the Life You Want. She brings you the latest research and interviews with experts in the field of cognitive sciences. Anyone who loves to grow and create growth for humanity gets a voice on this call-in show. Inner Voice Heartfelt Chat with Dr. Foojan. Monday afternoons at 3 p.m. Pacific on Smart Talk KMET 1490 AM and on KMET1490AM.com.
Hello, everyone. We're back with one of my favorite guest, and I've had the honor of having Dr. David Burns with me at the show many times, exploring his approach, a team approach. And for all of you who know him, I'm sure you're excited to have him as much as I am. And for some of you who don't know him, he's an adjunct professor emeritus in the Department of Psychiatry and Behavioral Sciences at the Stanford University School of Medicine, and the author of the best-selling books, Feeling Good, The New Mood Therapy, and Feeling Good Handbook. And now, for all of you who have been waiting for this for a long time, his latest book, Feeling Great, is out. So I'm excited for Dr. Burns to be here for us to talk about his book, Feeling Great. Welcome to the show.
Thank you. You're so generous in your praise. And I also have to say you're one of my favorite, if not my absolute favorite person for interviews. Every time we've worked together, it's been totally awesome. And I really appreciate it.
Thank you so much. I always learn so much from you. So I know that we all fell in love, millions and millions and millions of us, with Feeling Good for many years. I know that it's been translated to so many different languages, and it's been one of the books that I've really given to my clients, and I've asked them to, anybody who told me they have minor to major depression and anxiety, I've told them to get this book and read it and work through it, and it's really worked for everyone. What's the difference with the Feeling Great? What is it that you have, perfected, let's say, or the growth that have come within you and your learnings that has now showed itself in Feeling Great book?
Yeah, well, Feeling Great has a lot of new developments that just weren't in existence or even imagined when I wrote Feeling Good. Feeling Good was terrific, and it helps 50 to 65% of the depressed people who read it, and that was amazing. But over the years, I've said, well, that's great that you can hand Feeling Good to someone who's seriously depressed, and there's a better than 50% chance they'll be recovered with no other treatment in 4 weeks. But then I got to thinking, well, how about the other 50%, the ones that weren't helped so much? How were they different? And if we could figure that out, maybe we could add to those techniques, develop new techniques that would make the treatment even more powerful. And so that's exactly what's happened in the last 40 years. I've done research on how does change happen? How does psychotherapy really work? And I've also developed pretty incredible new techniques in the last 10 or 15 years with my group at Stanford. And now you might say that the new therapy in feeling great is a little like, sounds crude, but CBT, cognitive therapy on steroids. It's just vastly more powerful than traditional cognitive therapy.
I know that you've talked on actually on my show. We've had 4 segments for people who are with us today. And if you would like to go back and listen or view our last segments, which we have 4 different segments on your team approach, and team meaning testing, empathy, assessment of resistance, and then introducing your methods to them. As I read your book and I was going through Feeling Great, I was also seeing for all of you who must get this book, it has tests. It has tests on different areas where you could test yourself and really look at where you are. And then you go and you have this amazing soft technique of being kind to yourself and empathizing with with every part of you, and looking at even the parts which are resistant and finding, and this is, I think this part is the jewel that I've seen in your method, which is looking at the resistance. And many people look at it from a negative perspective, and you look at it from the gifts that it offers and brings out for people. And then you show them the skills to move forward. Can you share with us your approach, which people can find in this book, Feeling Great?
Yeah, I'll give you an example. Is often pictures worth 1,000 words. I do a lot of live therapy on my Feeling Good podcasts, just to prove to people that this claim of ultra rapid recovery is real and not just some kind of, con artistry. Because when I tell people how fast I'm now seeing results with severely depressed and anxious people, often recovering in a single extended 2-hour therapy session, they don't believe it, and that's understandable. If someone had told me 15 years ago that people with chronic severe depression could recover completely in one therapy session, I would have said, "You're nuts, you're a con artist." I wouldn't have believed it. So in one recent one that'll come out soon on my Feeling Good podcast, I worked with a really neat guy named Sonny, who was raised in Hong Kong, and the show is on the approval addiction, something that a lot of our listeners struggle with, feeling devastated by criticism or judgment or disapproval. And he had this approval addiction because in Hong Kong, the boy is favored over the daughter, which is horrible. It's a lot of the world is like that, sadly. So he always got the best food first before his daughter could choose, could get her food. And he learned how to earn his mother's approval, whereas his sister was a rebel and was often beaten. And he thinks back on those times with guilt. But at any rate, in his life, on several occasions, he's done his own thing, as opposed to always trying to please his mother, always trying to please other people. And the first thing was when he came out as a gay man in his 20s, and he was flooded with anxiety at that time, and then got over it and became proud of his identity and his sexual identity. The second one is his mother wanted him to be a high-tech guy in Silicon Valley. So he did that. He didn't want to go into engineering, but he did it. He's brilliant, and he studied at Stanford and had a tremendous Silicon Valley high-tech career. But he always wanted to help people. So his second big thing was giving up his career and getting trained as a clinical social worker and starting his therapy practice. And that, was anxiety provoking for him too, because, oh, what if I don't have all that approval, all that success you're supposed to have in Silicon Valley? He got over that. And then his recent episode, he decided just to give up half of his practice and just work half time and just do things he wanted to do with his life, and not just always trying to be successful, always trying to win approval. And so he was intensely anxious again. Now here's the kicker. One of his negative thoughts was, I shouldn't be anxious again. I should have gotten over this by now. And he believed that 100%. And that was one of the thoughts that was bumming him out. And then when we do the positive reframing, I try to show the patient that your negative thoughts and feelings don't show what's wrong with you, but what's right with you. And at first he couldn't get it. Like what did this thought show about him that was beautiful and awesome? Because we're thinking, oh, he's an anxiety disorder, there's something wrong with him, he's broken, we have to fix him. And the new techniques I do in feeling great are based on the opposite premise. Your depression and anxiety aren't the result of what's wrong with you, but what's right with you. But he couldn't see it. He couldn't see it. Why is it wonderful that he's all anxious up again? Because he's saying, I shouldn't be anxious. I should have gotten over this. That's the way you think when you're depressed or anxious. Well, suddenly, as we talked about it, it dawned on him that he should be anxious again. And why? Because he's moving to a higher level. Do you see? He's doing his thing and believing in himself in a more extreme way than ever before. And so his anxiety as actually an indicator that he's being brave and courageous and confronting his fears. And when he saw that, it blew his mind. And suddenly he was able to talk back to his negative thoughts and not only completely recover in one session, but really the goal of the new team therapy is not just recovery, but getting to a state of joy, enlightenment, ecstasy. And that's what happened to him. And so anyone who wants to hear exactly and blow by blow how the new team therapy works, that will be published as 2 consecutive podcasts soon. But I'm so proud of Sonny because he was ashamed of his anxiety, like so many anxious patients, thinking there's something wrong with him. And not only did he recover, but he had the positive feedback he got from the people who were watching the demonstration was just over the top. I mean, people were just loving him because of his vulnerability, because of his humanness. And that's another great thing about recovery, is that you discover that people love you for your flaws, for yourself, and not because you're going to impress them with some achievement or other. Or, there's, I think, a spiritual aspect to real recovery, which is mind-boggling. And I will now shut up since I'm talking too much.
It's beautiful. What showed up for me, and as I have watched you in many of the conferences and our own dialogue with each other and the book, one of the main concepts that I've watched you with the empathy and looking at the best aspect of the person, you bring the full-on acceptance and empathy that the person can have for themselves, and accepting everything that shows up from within and externally to them, and looking at it that no matter what, this is all okay and it needs to be. And then you can deal with it from all is well, and you don't deal with it from there's something wrong. And when you begin dealing with this from all is well, this concept of the extra force that we put on ourselves, which is the interpreted feelings and thought process that we put on top of what's here, is lifted. And then you deal with what is as is, and you have the skills, or you gain the skills to handle whatever it is you're needing to handle, versus this cloud that is put on top of it as if this is not supposed to be, and then you're fighting this.
Yeah, society tells us you're not supposed to be depressed and anxious. The American Psychiatric Association has their Diagnostic and Statistical Manual of Mental Disorders. And so everything is converted into a mental illness. You see, when I do workshops, I often say, how many with mental health professionals or the general public, I often say, how many of you sometimes struggle with social anxiety, public speaking anxiety, or feeling awkward in social situations? And, 2/3 of the hands, or 90% of the hands go up. Most of us suffer from social anxiety. I used to have 5 kinds of social anxiety, and they pretty severe on all of them, to be honest. And so what the Psychiatric Association says is, well, you don't have shyness, you have social anxiety disorder. So you're converting your feelings into a disorder. And then if you're really anxious, they say you have a personality disorder called avoidant personality disorder, because you avoid crowds because you're scared. But this is just a lot of nonsense. You're just taking human feelings and converting them into mental illnesses. It makes no sense. There are a few true mental illnesses. Schizophrenia is a sad and tragic and true mental illness, but shyness is not. Worrying is not. Feeling sad and depressed is not. But not only are these things not illnesses, they're really expressions of what's most beautiful and awesome about you. It's not your brokenness. It's not some chemical imbalance in your brain. It's your core values. For example, people who are listening right now who experience insecurity and self-doubt and depression sometimes, I'll bet you $1 to a dime that you beat up on yourself all the time. Self-critical thoughts. I'm not good enough. I shouldn't be so screwed up. I shouldn't have made this mistake. I shouldn't have made that mistake. I shouldn't have this problem. I shouldn't have that problem. I'm no good. I'm a loser. I'm a hopeless case. And then society and psychiatry and psychologists train us to view those as that there's something wrong with you, that you're thinking this way. And then all this shame, you get all the shame on top of the depression and the anxiety, and you're thinking, oh gosh, society says I'm defective, I'm broken in some way. And then psychiatrists say, if take all these pills, for the rest of your life, antidepressants, which by the way, really are barely better than placebos, if at all. And the great thing that people will learn in Feeling Great is that these are not expressions of what's wrong with you, but what's right with you, and that you can overcome these feelings without, in most cases, without having to take pills. Take self-criticisms, for example. What is relentless self-criticism, Foojan, show about someone who's depressed? What is beautiful about beating up on yourself all the time?
Well, it seems like you want to make yourself better. I mean, you're
well, that's for sure. That's awesome.
You're having a different, you're looking at different standards, and you're upgrading your standards, and you're holding yourself up to move to a different place. It also shows like you have some sort of a self-reflection, self-awareness, because you're, looking back at yourself and thinking, who am I and how am I doing?
Yeah.
Maybe I should move forward. So it seems like you're striving for excellence.
Right.
But from what's wrong versus what's great.
Yeah, and also shows that you're honest, because you do have a lot of flaws. I have so many flaws. I'm talking pretty well now, but I'm in my app. I do a lot of recording, and when I listen to the recordings, I have all these uhs and things I pronounce incorrectly. It's really kind of shocking. And so when you're self-critical, you're also accountable. Now we know certain people in the world who are not accountable. They just blame others. I wouldn't name any names, but given our political climate, you see this happening at an intense level. No one's looking at their own role. And if you're self-critical, it shows that you're accountable. It also shows that you're humble.
Yes.
And humble is a spiritual quality. And once a depressed person, and you can do this with depression, seeing the beautiful part of it, anxiety. What's beautiful about anxiety? Well, that's self-love, because you're trying to protect yourself from danger. And what's beautiful about guilt? Well, it shows that you have a moral compass. What's great about loneliness? Well, it shows that you have a love for others, and you want to bring someone in your life to give to and to love. What's wonderful about hopelessness? This was one of the hardest ones for me to figure out when I was writing Feeling Great and when I was developing team therapy, because Aaron Beck always taught that hopelessness is the worst emotion of all, and in a way it is. And so how could there be anything good about hopelessness? Can you think of anything? I don't want to put you on the spot.
I have to think though, because
It took me about a month to figure it out.
yeah, I'm also, and it's also a part of me that I can get to from zero to, if I can't have it the way that I want it, I really go to hopelessness really quick. So
Oh, yeah.
it's very close to my heart. So that type
Oh,
of
okay.
hopelessness. So thank you for bringing that into my world and looking at what is it that could be great about hopelessness.
Yeah.
The gift that it actually has.
Yeah, and what does it show about you and your values that's awesome, and what are benefits of being hopeless? And I'll spit it out if you want, because it came all at once on one of my Sunday hikes with my students, and they said, "Oh, that's what's great about hopelessness." Well, you want me to tell you?
Yeah.
Yeah. Well, number one, it shows that you're realistic, because a lot of the people who are depressed and hopeless a lot of people have come to me have had 20, 30, 40, 50 years of failed therapy for depression. They've taken drugs, they've had psychotherapy, and they're still seriously depressed. So when you say, I'm hopeless, it shows you're looking at the facts of your life as you see them in an honest way with integrity. That's certainly a positive thing. Number two, when people come to me for therapy, usually when I work with people, it's just for one session. And the expectation is they'll have a complete recovery in that one session, or sometimes two sessions. It has to be a double session. It has to be a 2-hour session. And so when someone comes to me and they're saying, Dr. Burns, I'm feeling hopeless, they're saying, I don't believe this baloney that you could cure me in one session. So it shows a kind of critical thinking, because it does sound like baloney. Then you're not going to be taken in, by a snake oil salesman or something like that. But the biggest thing about hopelessness that's so awesome is it protects you from disappointment. So you don't get your hopes up again and then get them crushed down. And so this is just one part of the team CBT that I talk about and feeling great, this positive reframing, but it's been the biggest breakthrough. Everything about team is really pretty new and fresh and different. But that's the thing that's really led to the high-speed recovery. Because in the old days, when a patient would come to me and I had, I'd written Feeling Good and I had all these cognitive therapy techniques, I had a lot of rapid recoveries, but it was like after 6 or 8 or 10 or 12 sessions, and it was for about maybe half of the people that I was seeing. Now I'm seeing rapid recovery 90% of the time in a single session. And it's so much fun to be able to do that, because when my patient not only recovers, but goes to a state of joy, a state of laughter, at the end of a session where they were sobbing at the beginning, that also puts me on a high.
Yes. Well, it's always a joy when I watch you work in conferences. And will I see you in the evolution of psychotherapy?
Oh, yeah. Now I have to figure out if I'm going to do any live work there. I have 5 presentations. I can't remember even what they are. But you know what I think they should have at a psychotherapy evolution conference? This is goofy. I've been kind of hiding it shamefully, but I've had this idea for, I would say, 30 years. We should have a psychotherapy Olympics. And any therapist could enter this competition, and you would be assigned a patient, given 2 hours with them, and we would measure the patient's symptoms at the start of the session and at the end of the session. How are you feeling now? And we could find out then, who the really great therapists are and who the BSers are. And it probably seems disrespectful, but we have an Olympics and everything else. Why not measure and let the public find out what therapists are really able to get rapid and lasting results for depression or anxiety or whatever.
I think that I think you bring, and we need to complete our conversation, but one of the things you're bringing is also testing and bringing measurement into
Yeah.
therapy, which I think is beautiful. Everyone, please get Feeling Great, and you can get it at feelinggreat.com, right?
Yes, or just go to Amazon. Just put "Feeling Great," Dr. David Burns. It'll bring you right to the book.
Beautiful. It was such an honor again to have you on my show. It's always a pleasure, and I always learn from you. And today I learned about hopelessness. So
yeah, awesome. Thank you. Your new hairdo looks great, by the way.
Thank you so much, everyone.
How about mine? I haven't had a haircut in 6 months.
Well, you're in Hawaii. That's what it looks like. So, have fun in Hawaii.
Thank you so much.
Everyone. We'll be right back.
Have you ever wished you could just wake up one day, reach across your nightstand, and hit the life reset button? Let's face it, the struggles and frustrations of everyday life leave millions of women and men around the globe yearning for a new way. And the new way is right here in Life Reset, the awareness integration path to create the life you want, by Dr. Foojan Zeine. You can get it now at Foojan.com or Amazon.com. Life Reset, the awareness integration path to create the life you want. You deserve it.
Well, welcome back, everyone. I'm Dr. Foojan Zeine, and I am excited to be with Bridgit Dengel Gaspard. She is a licensed social worker and is the author of Final Eighth and the founder of the New York Voice Dialogue Institute. She's a former performer who earned her master's degree from Columbia University and teaches at numerous professional settings, including Omega Institute. Welcome to the show.
Thank you. It's so great to be here.
It's wonderful to have you talk about your new book. I have been a therapist for 30 years. You're a therapist. And I know that the first thing we always work with is not only how the client is or the person is in our office and having a dialogue with us, but very soon we get to what's going on in their head. And every one of us have also heard it through our own, which there's a conversation that goes on within all of us. And this is not mental illness. This is actually mental health. This happens with all of us. And in your style of work, you have found a way to really work with those voices and create a way of bringing them together. So share with us what happened, like how did you get to that style, and how does that work?
So voice dialogue, it's a literal technique, and it was developed by my mentors, Hal and Sidra Stone. And it's absolutely a healthy personality. It's a health model that we are composed of many selves. So I am glad you said that, because that's very important. And so it's a literal technique where you talk to different parts of yourself, and you move over when you do classic voice dialogue, and you say, I'm Bridget in the middle, and I could go to my perfectionist self. And then you listen to that part, and you never ask the perfectionist self to kind of loosen up, something a perfectionist would never want to do. And a lot of the work, as you know, as a therapist and everything else you do, it's not just the words. So when we say dialogue, it's where's the self in the body? What's the energy of the self? What does it care about? Where is its wisdom? Because they all have the noble purpose of protection, and they all have wisdom, even though it might be a little hidden. And then you might go to a different self, and that different self, it could be a slob, like a direct opposite of a perfectionist, but it could be someone who wants to be more casual. And so there's a slight connection to the perfectionist, but it might not be your obvious opposite of a perfectionist. And then that casual self says, why does everything have to be perfectly planned in advance? Why can't I I would love if Bridget was more spontaneous. You talk about Bridget in the third person, because that literally brain imaging is makes a separation between our parts of ourselves, and that some of the brain imaging that's happening literally shows that we consider our different selves different parts of our brain pop up. So the perfectionist is stored in a different place than maybe your intellectual, which would be farther away from your amygdala. So I feel like brain science is just starting to verify what early pioneers of parts work have known for a long time. And it's so exciting.
You said the truth is not every part of you wants what you think you want. Some of your inner selves are opposed to your goal. And work with me.
Oh, I would love to.
I have a part which obviously wants to be healthy and wants to be about 100, let's say 60 pounds, and firm and healthy. And I have this other part which loves food. And I don't like exercise. So you got me wanting food and mostly fatty foods, and don't like exercising. And these two parts are very much in fight together. So the result ends up is that I get sick and tired of one side, and then I get really good at, good lifestyle and doing everything appropriately. So I do bring myself right to that edge and all of that. And then slowly but surely, the other side that loves food and doesn't like exercise kind of keeps creeping in and takes me back. And there's no bargaining here. I just go back until, the place that my health is saying, okay, no, like we can't pull this one more time. And then the other one takes over. And although I've gotten much better, where between like going back and forth, like 20 pounds here and there, but brought it more into like, 5-6 pounds here and there. But Bridgit, the agony of the conversations and this back and forthness is always there. So work with me.
This is beautiful. Thank you. So my heart goes out to what you're sharing. And I think all of us have been in their version of that. And so what you're talking about is the literal polarization. I'm either on the program or I'm off the program. I'm either healthy or not. And that's a win or no win on either side situation. And then you end up having the consequence of just feeling terrible in some form or another. So with voice dialogue, we would literally go to the part of you that loves to eat and maybe work with me a little bit more. Say a couple things about that part. What does that part love without it being judged? Remember, in voice dialogue, that part just gets to speak from its heart, unedited, no shoulds when it's voice dialogue, except if you want to go to your should self, then we can talk to that part. But what would your lover of food self want to share?
I think that it's one of the most amazing pleasures of life, besides sex. But they come right close, like they're right, yes. Kind of like even out there. And there's this particular taste, which is more like, if I don't have good taste in my mouth, what's the point of eating? Like eating is not necessarily the concept of food as energy, as fuel, as a life source. It's more pleasure. So if it's not pleasurable, I prefer not to have it. And if I'm having it, then it has to be something that I really enjoy the taste. And I call it addictive personality, which then when I enjoy something, the holding it in a perspective of a balance and saying that I'm going to have a small portion is not part of the game. So when I have it, then I want more and more and more. I've had times where I've had like 13 clients, about probably 7th or 8th client. All that I think about is I'm going to go home and I know this thing is in my refrigerator and I'm going to give myself this wonderful reward because I've worked so hard today and I deserve to have this wonderful reward for myself. So it's definitely pleasure and reward.
So with voice dialogue, and I know we're just doing a summation, one of the things I'd look at is what are the gifts that this part of you brings? And I hear several gifts. Can you think of some offhand? In other words, what's great? I mean, one is pleasure. It brings you pleasure, and there's nothing better than that.
The other one
Also,
is,
it sounds like standards, like you don't want you're not into just being a vacuum of food. My guess is your fridge is full of delectable, delicious things.
yep. And in one way, it's almost like taking care of myself in a weird way.
Yeah.
And I'm taking care of myself. Like I work hard and I just want to have pleasure, which is also what I deserve. So it's almost that type of, it's okay. Like you get the reward because you've been a good girl. So it's taking care of
Yes.
me.
And then this is where, like, if we were doing voice dialogue over time, we might say, okay, but what happens, say, at the 7th or the 8th client? So that part of you, the one that wants the food, is coming in because you do need self-care. And so, in fact, as you know, with more awareness, you can move in earlier with anything. So then maybe you would end up starting to think about changing your schedule. I can only do 6 clients and then I need to have a half-hour break or whatever it is. So you take care of the underlying principle that your eating self can only offer food. In other words, each of ourselves only can offer what they have to offer. So if you take care of the underlying need, which in this case, it just sounds like you're working too hard. And so the real way to take care of yourself would be, well, then don't do 8 clients and up to 13 without a break or whatever it is. I mean, I would talk. And so that would be a way to find out what that self cares about. And so each self, the perfectionist can only say, well, if you organize everything, you'll feel better. So your perfectionist would offer you something else, but the food offers you. And then in terms of my book, which really focuses on when you're close to a goal and you see it, but you don't cross it, it's like what's going on, what needs protection. And one of the things, and this is women a lot more than men, at least in my practice, appetite tells you what you want. And a lot of people have conflicted relationships with their appetite. And so with the eating cells, whatever it is for someone, I like to also then go, well, okay, so it's an appetite self. How lovely is that? It's only problematic when you start to move into poor health, or it's messing with your goals because you're so exhausted from, say, a sugar hangover or an alcohol hangover or whatever it is. That's when it's bad. But let's go back, and then with voice dialogue, well, let's talk to the appetite. What do you want? And then you can relate it to the goal in question or just life as a whole.
Well, my appetite says that when I see something which is tasty, I just want to devour it. And I think life is joyous only in this way. And I'm a very much more like, I either want it my way or I don't want it at all. It's very clear. Like we use that standard, it's very clear. Like I either want it my way and my way is this, or what's the point? So my appetite is also saying like, I have these standards and it should be this way, or what's the point of having that? And then it goes into the concept of what's the even point of living if I can't have it my way. It goes that way.
Yeah. Well, I'm glad you brought that up because that's true. And then for people who are geared toward depression, that's the fundamental question. We need to answer of course, I'm a therapist and I'm always there to help against choosing a suicide. But these selves carry something as strong as what's the point of living? And then if you start to talk about that, as opposed to I had too much chocolate yesterday and making the whole conversation about should I have had 2 pieces instead of 4, that's an important conversation. But the deeper one is, all right, well, what is the point of living for you? I mean, living is wonderful. And maybe your life is too small. That's the other thing is we upgrade. Maybe your appetite self needs something bigger than a diet plan. Maybe if you give it something that like really resonates with your heart, and it can be part of that, whether it's planning the dinner party after the show when you have a show or something like that. That's another thing that often works. These selves, if you give them something bigger and more to their like power, they're happy to shift from counting calories to the bigger picture.
I got that. So it's more like when a part of you gets so bogged down with a small problem, you give it you open the grip a little bit bigger for it to look at the bigger you and the bigger concept of out there and your purpose. You're doing all of this versus each part of you hangs on to dear life with one of the values.
Exactly.
Beautiful. I also saw in what you said was that, the process of identifying and speaking with our inner self, such as the inner critic, the perfectionist, the artist, the risk taker, to figure out which of them supports our bigger goal. And part of what we were just talking about is the bigger goal, like you said, like each part might have their own individual goals, but if each one of those individual goals are geared toward the bigger goal of all of me, then they might also be kind of like negotiated into it, into the bigger system and the whole system, right?
Exactly. And that part of you that says, I want it my way, or no, or skip the whole thing. We might even go to that part and say, okay, and then find out that this is, say, a 4-year-old whose biggest power is to say no. Then in the process, you can take care of your 4-year-old and be kind to it and give it what it wants, but it shouldn't be your CEO in terms of your big adult heart-filled passion, but it still needs love and compassion from you. So that's the other thing. So many people don't understand why they're halting right in front of their finish line. And often it's because these very primitive inner children are in charge. And by primitive, it's just that they have early developmental level skills. They are 4 and they're not going to get more than 4. We are going to get more than 4, and we take care of our inner 4-year-olds. So that's another place where it's like, oh, right, they shouldn't be driving my car. They shouldn't be at the negotiation table. And that's so empowering, because you thought you were just stuck with this smaller definition of who you are. But it's also scary, and that's why there's often a halt, literally a tug of war between the cells that are pro the goal and believe in you. And then the other cells, the other part is they're often attached to core negative beliefs, even if you're not conscious about it. So whatever negative beliefs you grew up with in your early childhood, some of those cells are still attached. They believe it, but also it's a loyalty. If you were taught at an early age that life doesn't work out, there's like an inner betrayal that happens. And so that's the other part with voice dialogue. You get to talk to these parts, and then in center, you don't do the pendulum swing between either yes or no. You can be much more flexible and have more success at a little bit of yes and a little bit of no, instead of it's either on or off. I'm either doing my health or I'm not.
You're letting them meet somewhere in the middle where they
and then you have to be the one to operate the change. It's like you become the conductor of the orchestra. It's not whoever feels like playing gets to play.
Right. Bridgit, how does this work with addiction? I know that I work a lot with addictive personalities and addiction itself and the behavioral aspect. I consider myself to have an addictive personality. And when you're talking about the voice dialogue, and for any of our audience that has a conversation or a habit or the illness, however they like to call it, of addiction, how do you utilize this voice dialogue between the parts? Because obviously, when we're looking at addiction, you certainly look at these split off sides, which are constantly going back and forth.
Right. And we would call them like hidden cells or disowned cells. So with voice dialogue, and all of this is in the book, I have a really easy how-to guide for readers, which is great. You would go to the self. So a few cells in relation, let's just say the substance is alcohol. So you go to the self that loves alcohol and you just listen. And what do you love about it? And tell me more. What are your early experiences? And often that's where a lot of grief is. And so even that alcohol substance loving self is trying to make you feel better. Even also, maybe that was the way you connected with a dad or some early people that you loved in your life. And then you can talk to some other selves, and whether it's the self that says you shouldn't, but then what I love to do is be the substance. So we get to the self that's, let's just say, I know I love a glass of wine. And when I have a glass of wine, I'm looser and you can see it in my body. I get to talk to like wine if we're doing voice dialogue. So wine gets to just be this delicious sensation. And it could be anything. People who love Valium, it does not matter, insert substance. That is usually so edifying on many ways, like, wow, including you can just access that energy. You don't need the wine to find the part of you that can just be present and loose or hyperactive and focused. Like different drugs, as you know, are attractive to different types of people because they want that property. I want focus. I need to let go. But you have it all physiologically, and that's fun, I have to admit, and really liberating. So that's what, many of the ways we would start to look at the addiction selves.
In 1 minute, tell our audience what it is that we haven't talked and you really want them to know.
That there's such power in curiosity. If you can put down your defenses and say, I know what I know, but I don't know what I don't know, and just be curious, and being able to enter a self, having an idea about it, but then being curious, what else is there? I've been at this since 1995. I still get surprises when you really, really listen. So that's what I would do. Just be curious, because even those of us who know each other really well and know ourselves really well are going to have wonderful surprises.
Yeah, very well. So everyone, Bridgit Dengel Gaspard, please go get the final 8th. And you could find it on newyorkvoicedialogue.com. And it has been a pleasure having you at the show. And I'd love for everyone to get your book. I know that the book is, it's written in a way that is, gives you, everyone who's reading it, the practical tools in how to work within the internal part of you. And also you can find Bridgit at newyorkvoicedialogue.com. Thank you so much for being on the show.
Oh, thank you.
Take good care, everyone. Create an amazing life for yourself and everyone. And until next week, bye-bye.